today we have Keisha L. Jackson, a U.S. Air Force veteran and family caregiver. And Keisha has a very unique story. She is a 22-year retired Air Force veteran. After caring for her mother, who had stage 4 inoperable lung cancer, Keisha started learning about caregiver resources to share with our other family caregivers. And as her guest, we have a special person, Dr. Fayon Epps. She's a principal investigator of Faith Village Research Lab. Dr. Epps is an assistant professor at Emory University, Nell Hodson Woodruff School of Nursing. She has devoted her career as a nurse leader to reducing health disparities for underserved populations through innovative, culturally relevant programs for the African American community. Dr. Epps works closely with an interdisciplinary team to promote quality of life for African Americans living with dementia and their family caregivers, care partners through self-care and meaningful activities. Dr. Epps is also the founder of Alter, the only nurse-led dementia-friendly initiative to support African American congregations. And it is such an honor to have both of you on. And, how are you doing, Keisha, first?
Hi, Dr. Arnold. How are you?
Fine. It's always a pleasure and a delight to hear your voice.
Yeah, yours as well. I think this is a happy New Year. I think this is the first time I've talked to you this year.
On this show, right?
Yeah.
And then,
before Dr. Epps, you bring her on, I just wanted to mention a little bit. I got a chance to meet her through Delon Canterbury, Dr. Canterbury, and she and I were able to have a conversation, and I was impressed is not the word, right? Because it's not about being impressed, and she's not someone that tries to impress you. She's just someone that's really great, that knows what she's doing, and she knows her stuff. But I wanted to say, in the conversation that she and I had, one of the reasons why I got into caregiving to the extent that I am is because while I was caring for my mother, and after I was caring for my mother with cancer, I was caring for one of my brothers. I was his primary caregiver who had fallen, and he was placed on life support. And in the process of caring for my mother and my brother, I started going to these conferences. And matter of fact, I had the CEO of Gary Berg from Caregiving last month on the show. And when I went to that caregiving conferences, I began to notice that there were people there, a lot of people, but there were not a lot of people of color, and there were not a lot of men there. And so it pressed upon me because there was so much information that was being shared, so many resources, so much networking, and so many connections that I wanted to be able to bring it into our community, to people of color in particular. And so when I talked to Dr. Fayon on that first phone call that we had, I was able to gel with her because it was like kindred spirits, and it just meshed. So I'm looking forward to what she's going to talk about today, because I think it's going to be of great importance to our community.
Fantastic. Thank you so much, Keisha. And Dr. Epps, an initial question I was going to ask you about, caregiving while Black, why this is an important focus. And what would you want military family caregivers to know about caregiving while Black?
Well, thank you all for having me. I'm going to say Happy New Year, too.
Happy New Year.
Yeah.
Yes.
But no, thank you, Dr. Arnold, for having me, and thank you, Keisha, for that, for adding on to the introduction. And I'm glad to be here and to speak about Caregiving While Black. This is a education program that I developed because I noticed in my interactions with Black caregivers, particularly those, I do a lot in the dementia field, so those caring for individuals living with dementia, I noticed that there was an additional layer of challenges that they were faced with while on this caregiving journey. And no one was really addressing those challenges. People would say, oh, yeah, we have a culturally appropriate program and this and that. But that program really touching on what a Black person in America is going through while they're on their caregiving journey. Mm-hmm. And so, I kept hearing feedback, and I tell people when I'm walking the street, because I do a lot in the community, and they're like, Dr. Epps, that course was great, but it didn't address what I'm going through. I'm having a challenge trying to get to the grocery store to get healthy food, not my challenge of trying to go to Paris. And I was like, wow, what's going to help me? How can I thrive? And that's when I got with my colleagues. Dr. Arnold was like, we have to do something about this. And, I've developed other education programs, and they were just really general. They were really general. And I said, you know what? Let me bring my peeps. Let me bring my peeps in, and let's address this. Being Black in America and being a caregiver, and how can we manage home life? How can we navigate with the healthcare system? And how can we take care of ourselves? So I'm going to pause right here because I can keep on going and going, Dr. Ordo. But
really important. I mean, you bring up some extremely important points. And, there's one thing we can always theorize about things and think about cures, but we have to talk to people to see if they're working and how, how they fit into this treatment or healthcare model, right, for making their lives better. So I have to applaud you for that.
Thank you. Yeah, and it's about having better outcomes. And so I am a nurse. I've been a nurse for over 20 years. And, I've seen some things, and I think all of us who've interacted with the healthcare system, if we can just take a minute and just pause right there, we'll know that we've seen stuff. And now a lot of things are coming to the light about some medical discrimination and things like that. Yes. But I know as one person, I cannot change the system. But I felt that if I get with my colleagues, we can empower Black caregivers, Black patients, so when they interact with the health system, they can get better outcomes because now we're giving them the tools that they need. And these tools speak directly to them. So, what was so funny when I was trying to take a course shell and try to tailor it, I thought it was going to be easy, Dr. Arnold. Y'all, it was not easy because I had to break all of those words down, and I needed to just keep it real.
Right.
And that's what this course does. And when I brought in physicians, they was like, all right, Fayon, what you want me to talk about? Well, what? And I was like, you know what? I brought them in the studio. I said, forget your job. I want you to tell me what you want to tell every Black patient that comes across your threshold, comes in your clinic, that you cannot because of your constraints of your workplace.
Right.
And they say, you for real? I said, I am for real.
Yes, yeah.
And I said, let it loose. And I learned, like I said, I've been a nurse for 20 plus years. I even learned some things on how to interact with the health system, how much time, how to navigate my time and a physician's with a visit with a provider. Yeah. Understanding that they have their agenda, I have my agenda. How can we come together to get the things that we need, and how to have the hospital with discharge planning? I mean, we go through all of that in this program. And I walked away. I didn't even take the course. I just put it together, but I walked away like, wait, now I really know how to take care of myself and even help my family members.
Yeah. So what are some of the resources available for veterans, active military and their families, with respect to health and mental health issues?
Dr. Arnold, go ahead, Fayon.
No, you can go ahead.
Oh, I did want to say a little bit about, with the military, with the aging population, the chances of people having a form of dementia is greater. You know, with the military also, there's the PTS, there's the depression that comes with being in the military, there's the traumatic brain injury. So within our community, it's so important that we learn how to take care of our loved ones, because a lot of times we don't really think about it as dementia or any form of dementia. So I do know that the VA, of course, the VA has a lot of programs. I think it's Alzheimer's.org. I think it's ALZ.org. There's there's a lot of information. There's a lot of resources out there that are available for people. When you think about blacks as a whole, a lot of times us as caregivers, you'll hear about us being underpaid or not paid, and with this being April being Volunteer Appreciation Month, this is a time to definitely honor those caregivers, because a lot of times, like I was saying, we're not paid. And right now we're going back with the government in terms of, are we going to cut funds for caregivers or not caregivers? So I would definitely have people to tap in. I always tell people to tap into the VA to find out all of your local resources on your local area on aging, to always tap into those resources, because they're going to be able to help you. You have AARP. Those are in your local areas. They're going to be specifically to help you get help in those areas. But yeah, this Caregiving While Black course, I think it could be very, very helpful for people as well.
You bring
even those in the military.
You bring up a really important point, because we have to really look at this comprehensively, because one of the things that we always run into is that there are not enough care mental health providers as well, right? Psychiatrists, psychologists, and even social workers and people who are trained in taking care of people with mental health issues. And that in itself causes, I guess, more problems for caregivers, because if you can't find someone, to take care of your loved one, then you're still, it's like doubly being hit, right? Because not only do you have to take care of them, but you're searching all over the place to find out who can take care of them.
Yes, and so I actually run into that a lot when I'm in the community, because people, where do I go? You're saying I think I may have a problem. You're out here in the community. You're talking about this, but now I need to go see a provider. Where do I go? And I am now working. Now I'm taking it on as working with agencies, so we can find have a hub where they can go and type in their zip code. So if someone takes a memory questionnaire online using mybrainguide.org, afterwards we will be putting up a tab that will come up. If you need to see a doctor, type in your address. These are the types of doctors that you can go and see, or call your insurance company and say, these are the ones that you want to see. But that is a problem. And I want to tell something else that we're noticing. When they do get to the doctor, a lot of doctors are dismissing the complaint.
Yes.
That they're bringing forth, especially if they don't look the typical way that they think someone with this diagnosis should look. And that's not right. And so I want to tell all our listeners, if that is happening, do not take that and say, oh, I guess I can't get help. No, you reach out more to some of the resources that were mentioned, or go to another doctor until you find someone that does listen to what's going on with you or the person you're caring for.
Yeah, I couldn't agree with you more about that. You just can't brush things under the carpet. And one of the things, I'm going to get on my public health soapbox now, but one of the things I'm thinking about is in the background is COVID-19. And, in communities of color, the Latino community, African-American community, the vaccination rates aren't as high as they should be. And it was kind of interesting, and I'm not sure what the implications for this are, but when I looked at the Mayo Clinic reports about the association between COVID-19 and, the more rapid progression of things like Alzheimer's disease, it's tied into other, mental health issues, including things like, Parkinson's disease itself, just the anatomical piece of it. But it seems like this is actually affecting multi-organ systems. And a report just came out 2 days ago about the progression of heart disease from the CDC, where they're finding people who are not vaccinated have a higher incidence of heart disease. And I'm wondering, what is the implication of this for the mental health field? And will there be things like we have long hauler syndrome, where people are in a fog and those kinds of things? So there may be mental health implications coming out of this pandemic that we're not really looking at yet, or that will need more special attention. So, what advice would you give military family caregivers? How can they seek more information, or is there a place they can go to get the kind of help they need? Because sometimes you have to step in for someone who has a mental illness because you notice things that are happening, and the person may not feel, or may feel threatened by that, or feel embarrassed about it, or going through other things, that where they're just trying to downplay what's going on. So, what advice would you give to the caregivers and to family members as far as seeking advice and becoming a caregiver to begin with?
Yeah, and so I think I'll piggyback on some of the resources that was mentioned before. And, as we're seeking help for those with mental health illnesses, and even for those with neurocognitive diseases, because that's where dementia will fall under, it is using the resources, tapping into the resources as part of the VA system, but also outside of the VA system. Both of my parents are retired from the military, and I tried to make sure I stressed to them, the resources within the VA system is great, but also AARP is awesome because they have so much information about caregiving. And if you're in the beginning, they have Prepared to Care guide. So they have a lot of resources that they have put out. I partner with them so we can educate the community, and for those that are interested on learning how to be a caregiver or how to utilize resources, they're really good. And then each condition, if someone is diagnosed with a particular condition, they have an association that caregivers can tap into. So if it's Parkinson's, there's a Parkinson's association. If it's dementia, then it's Alzheimer's association, and several others as well. So it just depends on what the person is diagnosed with, or maybe what they're dealing with. Then they can tap into that as well. And I'm sorry, Dr. Arnold, I think I might have cut you off.
Oh, no, you weren't. I was just agreeing with you. I think this is fantastic, these resources.
I wanted to jump in and say something because I know our time is almost up. But I had someone one of my friends on the show last year who was caring for her mom with a form of dementia, Loretta Vini. And she mentioned, and I say this because of resources, she said her mother was diagnosed with early dementia in 2006. And at that time, she didn't seek out resources because she felt like she was financially able to take care of it. And it wasn't until 3 years later where she realized that her funds were being depleted, and she was like 692 on the list. Wow. And it wasn't until it took a full 8 years for her to be able to get the assistance that she needed for her mother. So I just say that because, as Dr. Epps has said and I've said, there are resources out there. Start early, having those meetings, those counseling, going to doctors, having those appointments, finding out what's out there, what's available to help you so you can help your loved one and you could actually help yourself.
Yes, yeah. So if we have something going on with a leaky roof, we want to make sure we have the maintenance in place first, and anticipating something that may be coming down the road. We have to really be cognizant and having situational awareness and be aware that these things are going to be needed, those services. So really, a very wise recommendation to people who are out there listening. But we're running out of time, as you were saying. I just, this is such an important topic. I'm really looking forward to having the likes of Keisha L. Jackson and Dr. Fayon Epps coming back here to talk us more about this, because I think this is going to become an increasing problem in our community as people are aging now as well. And as I mentioned, the COVID, I'm still very, very cognizant. Up to 2 years ago, I was mentioning that, you may have multi-organ system involvement because this virus attacks blood vessels throughout the body. And it looks like some of that is coming to light now that these things are happening. So we don't know what's going to be needed out there. You put that on top of TBI or PTSD and depression and dementia and Alzheimer's disease. It's not a good recipe, that we're following right now. So I want to thank our outstanding people who are on this call right now. And we are looking forward to speaking with you again, Dr. Epps and Keisha L. Jackson, our partner in this web of informing our veterans.